Okay, here we go. We're going to wind down. I'm going to talk to you about some medications, some of the most common medications on the sheet of paper that we gave to you this evening. The first one is cholesterol. Now, we have already talked about cholesterol quite a bit. Dr. Bob's ABCs, apple, beets, and carrots. But what most people don't realize is that inflammation causes your cholesterol to go up. That's why you want to get Dr. Bob's Trans Fat Survival Guide, because we talk about that in detail about cholesterol. We talk about the statin drugs, and I think that you need to get in your mind that you have to function with your liver. It causes liver dysfunction. GERD is another one. I didn't talk a lot about GERD. GERD is gastro. This is a big word. GERD is gastroesophageal reflux disease. That's why we do spinal adjustments to the mid-back area. On our webpage, we use a product which is a whole food digestive enzyme. We use a product called Zypan. We usually have our patients take about one a day. As a side note, don't drink water with your meals. Never drink cold water with your meals. It'll cause digestive distress. If you're going to eat leftovers, always warm them up. Never eat cold leftovers. You know my favorite food used to be before I got really saved on the food thing? Was Pepsi and cold pizza. Oh man, to die for. Depression. I'm not depressed. And see, the thing is that depression is really common today. And my wife and I are writing a book on sex and romance, and if you're taking antidepressants, you're not going to want to have desire to have sex. And I'm just saying that not to be silly, it's true. 50 million Americans are on antidepressants. Can you imagine we live in America, the most phenomenal country in the whole world, and people are depressed? They need oil. The biggest downfall in America today is the wrong kind of oil. I'll be doing a seminar on Alzheimer's. You don't want trans fat. I believe in my heart, trans fat is the leading cause of Alzheimer's in our society today. So depression. And these antidepressants have bad effects. And I have one person, a little side note, I don't usually talk about this in a half hour of health, but if you're taking an SSR, the select serotonin reuptake inhibitors like Cymbalta, see, that works by keeping serotonin in solution in your brain. Well, what I suggested to this person is this. She could take niacinamide. B6 niacinamide is what we use in our office. Your body works with B6 and tryptophan. I would encourage you, turkey, tuna. We use a product in our office called Protofood. So you could take a B6 niacinamide, a Protofood, and DHA from salmon oil, and that could be a way over time, because see, it takes those drugs up to 3 weeks to kick in. It's going to take 3 weeks to kick out. So Cymbalta, and you can get off some of those other medications. Pain. Just remember this. Sugar causes pain. Dairy causes pain. The wrong kind of oil causes pain. I didn't even touch on diabetes. If you want to prevent diabetes, actually if you are a chiropractic patient, your statistical chances of getting diabetes is down. But if you're not a chiropractic patient yet, mid-back adjustments are huge to help prevent diabetes. You want to lose weight. Most diabetics are overweight. Not all overweight people become diabetics. You need to exercise. I was reading an article that we have a chair society. If you get from one chair and we go to another chair. We are a chair society. We got to get rid of the chairs. You need to stand up and move around. You need to exercise. Okay, allergies. The leading cause of allergies is poor digestion. Most people are alkaline. Alkaline is like baking soda. We have pH paper on our webpage, but we encourage you to take flax oil. 1 tablespoon of flax oil per day that will stop the leaky gut syndrome. Osteoarthritis. Osteoarthritis is inflammation. Now what can cause it? I've seen dairy cause it. I've seen sugar cause it. I've seen not enough oil cause it. You got to get rid of the inflammation. Osteoarthritis is inflammation of the joints. Osteoporosis, the best way to get rid of osteoporosis is don't drink soda pop. Don't eat sugar. Eat more protein. It seems like when people hit about 6 years old, they stop eating protein. Everybody in this room should be eating protein with each meal. 3 to 5 ounces of protein. I eat a lot of organic deli meats, turkey and chicken. Sleep disorders. You know, I never had a problem falling asleep at night. If you have problems falling asleep at night, take some calcium before you go to bed. Calcium lactate. Make sure that you exercise. Asthma is caused by adrenal gland burnout. The adrenal gland is a very important gland. There's an awesome book called Adrenal Fatigue. Adrenal Fatigue by James Wilson. Stay away from fruit. Citrus can cause asthma issues. Sugar. dairy can cause asthma. One other item is I have a 12-year-old boy that was in the office tonight. He told me that when he does his head slides like this, look at me up here, when he does his head slides about 12, it stops the asthma attacks, and we took him off of Wheaties. His asthma went away, getting off the Wheaties. So how does chiropractic fit in the health equation? When you get an adjustment, your nervous system has to work better. When we do a spinal adjustment right here, that helps your immune system. I mean, it's amazing the miracles that we see in office. Some of you in this room had your own miracles already. Energy's better, you think clearly, you can smell better. Not that you smell better, but your sense of smell is improved. Okay, thank you, Jesus, for that. And your bowels are moving better. I mean, people come in the office. See, I get my high, because people say, well, geez, Dr. Bob, you know you've been doing this for 30 years. What do you get excited? Because every time somebody comes in, they have this grin on their face. That's my Zoloft. That's just a joke. What about herbs? You know, Bible talks about herbs. I take 4 herbs a day with my salad. Chives. Chives are a great source of sulfur. I don't know what's in basil, but I take basil every day. Dill. I don't know what's in dill, but it tastes good. And parsley. Parsley is great for kidneys. Parsley. I put parsley. So my wife, every day we put it in our salad. I personally take dandelion root every day. See, Hippocrates says this. I'm not Hippocrates, I'm not pretending to be, but let food be your medicine, and let medicine be your food. That's pretty profound, isn't it? So, one last item. How can you get off the medications that you're on? Well, this slip of paper right here that has all the different drugs on it, and the different herbs that we use is a good start. I don't think that anybody should go and just get off of their meds. Now, I know that with Jim, he gave you his testimony, he changed his diet. A fool is a person who thinks they can do the same thing over and over again and get a different result. If you're taking high blood pressure medication, you have this big old belly, and you're not drinking any water, you're smoking cigarettes, and you're drinking a half a gallon of soda pop every day, more than likely your blood pressure is not going to go down. If you're a diabetic and you're eating 2 pieces of cake every day, and that's just the starters, your diabetes is not going to go away. So for you to get the improvement you need, and we talked about all the high spots already, you need to exercise, drink water from a pure source, eat whole food. Now, I wasn't planning on telling you this tonight, but I think another item that people don't realize is, I'm going to talk more about this, don't eat canned food. Because the research is showing you, guess what they put inside of the cans? A plastic. And that plastic, when they heat it, and you say, well, I don't heat my canned food in. When they pasteurize that can, they're heating it to extreme temperatures. And I believe, God is my witness, what's happening in our society today, and I'm not saying to be silly, we're dying because of our water. It was just recently reported there's antidepressants, there's estrogen in water, the canned food is not healthy. I don't eat canned food, I've never eaten canned food. We eat real food, whole food. Even in the north, you can always, the squash are good for almost all, there's always something to eat that you can get fresh. Now don't be depressed, drink your water, start eating whole food, you start losing a little bit of weight, and what's going to happen is you're going to start noticing reactions because of all the drugs that you're on, then you can start backing off. Always talk to your healthcare provider that prescribed the medication to you. Talk to your pharmacist, work together as a team, talk to me, we'll be happy to do whatever we can to make a difference. Trust me, if you make these difference, you'll obviously be really glad you did.